If you join us, say hi, let us know where you're watching from. Hey, Lori. Sue. From Nebraska. Tammy and Doc. And Jerry is with us. Lee. Nursery. Here's Bunch joining us today. All right, guys, we're going to go ahead and get started. Tony is back with us today, and he's going to talk about joint health and arthritis in pets. Be sure to post your questions in the comments. We are going to give a ValueVet gift card away at the end of this segment. So you want to make sure that you have a chance to win that. And at the end, we also have a very special announcement, another giveaway that we're going to tell you all about. So stay tuned for that. And with that, we're going to turn it over to Dr. Tony.
Hello, everybody. Hope everybody's doing well today. So today we're going to talk about joint health and specifically arthritis in our pets, dogs and cats both, although dogs are going to be the ones that we're probably going to focus on. And so if you guys have any questions, please put them in the comment box. I'll do my best to keep an eye on it, and they'll help me sort through those questions so we can get them answered for you. So today we're going to start, and when I'm talking with clients about arthritis in their pets, there's 4 big sections that I like to discuss. And those would be weight management in our animals. It would be joint supplements, controlled exercise, and then prescription medications for pain control. So we just saw that one pop up, Brett. That was a good one. No pun intended. Brett commented, if nobody else can see it, it says, I've been aching for this one. So that was a nice joke to get us started here. So kind of the cornerstone of arthritis management, prevention, and then both prevention, and management of the disease is weight management. And we have some long-term studies in our pets, dogs specifically, and they followed these dogs throughout their lives, and they've shown that lean dogs kept in an ideal body condition score, can live up to 15% longer lifespans, and that's an average of 2 years in our pets. So that's some quality time that we can extend their lifespan, and it also significantly delays the onset of arthritis. So when we're talking about taking care of our pets, keeping their weight in an ideal range is one of the most important things that we can do. It prevents all kinds of diseases, heart disease. I shouldn't say prevent, but it minimizes the risk of all kinds of diseases such as heart disease and diabetes as well. So that being said, the ideal body condition score, there's some references on the internet, but on a scale of 9, it would be in the 5. And that would be where you can easily feel their ribs, but you shouldn't be able to see it. The way I like to describe it is if you have your hand on the back side of your hand, your knuckles, that's going to be a dog that's underweight. But this side of your hand, when you rub your fingers over it, the way that feels, that's going to be what it should feel like if your dog's in an ideal body condition. So it's just an easy thing for everybody to kind of see and feel what it should be like over the ribs of your dog. If your dog already has arthritis, weight loss can be a very effective management tool. It minimizes pain, it increases quality of life, and then it slows progression. So it's important to keep them lean early to slow the onset of it, but it's also important to put them on a weight loss plan if they've already got it. So that's a big point I wanted to touch on. If there's any questions, I'd be happy to address them at this point. Otherwise, we can sure move on to the next one. So exercise is another very important management tool for arthritis. There is some misconception out there that dogs with arthritis should not be exercised, and that's actually not true. Exercise promotes the production of joint fluid, which acts as kind of a cushion inside that joint space. So it is a good tool. Now, where that misconception arises from is we don't want periods of uncontrolled activity. We don't want our arthritic dogs to go outside and play catch, running and jumping as fast as they can for 15 minutes, because that can really exacerbate some joint damage and then make that disease progress a little bit faster and make them painful for a period of time. We want controlled exercise. We want regular exercise. So doing the same amount of exercise every day is ideal. Take them on a walk, whatever that distance is. Let your dog and your dog's ability decide that. But doing that daily or on a regular basis is important. We also don't want the weekend warrior where the dog is laying around all week and then you'd go on a 2-3 mile hike over the weekend, because that's the same thing. It can really exacerbate that process. So that's a very important management tool for us as well, on top of the weight, and it also helps maintain that weight in an ideal range. So I'm seeing some comments pop up here. Connie popped up the question here. You only see partial of it, so I'll read the whole thing. It says, I have a very healthy 4-year-old female German Shepherd. I know Shepherds are prone to joint problems. What supplements would you recommend? She may be slightly over ideal weight at present, but not bad. That's a good question, Connie. And that's a good lead in, because that was the next thing that I wanted to discuss. And this is a big topic when we're talking about joint supplements. The reason for that is because there are so many different products to choose from with a lot of different ingredients. And to be honest with you, we don't have a lot of good research or data on how effective they are. We have a lot of anecdotal data. And what that means is people that use it give us some stories about whether or not they work. But that can be different between different situations. So the point of that being is that I think they are good products. I think that you should try them and use them, but they may not work for you. And if they don't get discouraged and try something else, because these products are effective in my opinion, but different ingredients work differently for each individual dog. So I'll go over a few of the big ingredients here real quick, and then kind of talk about maybe some specific products that we could recommend. As a side note, though, I might mention that joint supplements are always better for prevention or early on in the disease, rather than more of a treatment when they get bad. What these joint supplements are intended for is to minimize or delay destruction of that joint cartilage, help promote synovial fluid inside of that joint. And so if we can get those processes started early on, or even as preventative, that's where we really want to attack it. So that being said, one popular ingredient for this purpose is omega-3 fatty acids, and specifically the EPA fatty acid type of omega-3s. Don't ask me what the difference is between the different types of omega-3s, because that's beyond my knowledge level. But it's been shown that the EPA omega-3s are more effective than the other types. So like fish oils are naturally high in those EPAs. Salmon oil is a product we carry, and it's one that could be effective for you. And omega-3s are anti-inflammatory naturally, and they do provide some joint lubrication. So that would be a good option for you to think about. Chondroitin and glucosamine are very popular ingredients in our joint supplements. Their intention is to minimize the destruction of joint cartilage and to help promote healing and regeneration of that joint cartilage. So that's important. It prevents the bone-on-bone phenomenon that can cause some pretty severe pain. So if we can avoid that joint cartilage breakdown. Another very popular one is hyaluronic acid, and that's an important ingredient for synovial fluid production. So if we can encourage that synovial fluid does is it acts as a cushion in that joint to just really give us, that lubrication over those surfaces. There's other ones that are, maybe not quite as popular, but they still can be effective. MSM, ester C, or vitamin C, potent anti-inflammatories, and then ASU and our Cosequin products. It stands for avocado soybean unsaponifiables, and that's kind of a synergist, and it has been shown to be pretty effective. So those ingredients can be found in some products, and that's what those are for. Now, kind of a newer product, and one that has really anecdotally worked very well for a lot of pets. It's a fatty acid called cetyl myristoyl. Okay, cetyl M for short, commonly. And this fatty acid actually was discovered in species of animals that naturally never get arthritis. And so investigators started to see this and find this out, that these animals never got arthritis, and they started to want to figure out why, obviously. And they found this fatty acid inside of their joints. And so it really anecdotally, it seems to work well for a lot of pets to really decrease that pain and to slow the progression of arthritis. So that would be one that I commonly recommend for people to try, is in a supplement that has that cetyl M included. And commonly those products have other ingredients such as hyaluronic acid or glucosamine chondroitin. So that's one that I like. And then finally, we have some injectable products, typically prescription-based, called polysulfated glycosaminoglycans. And you can talk with your veterinarian about this, but they're kind of an all-in-one, and they're intended for anti-inflammatory effect or action. Excuse me. They're intended to minimize joint cartilage destruction and rebuild that joint cartilage, and then also to really encourage that production of synovial fluid. So again, these products anecdotally really seem to work well, and Adequan would be one. That's kind of the brand name for that, but there are some generics for that as well. So talk with your veterinarian about that. Like I said, they're prescription based, so your veterinarian would need to be involved if you're going to use something like that. So that was a big topic. If we have any questions popped up, I'm going to probably address those, but there is one more topic that we should discuss before we get done here. Okay, so Sue, I'm going to read the whole question. It's long, so it's scrolling down there for you, but I'll read it for everybody. My parents have a small terrier with progressive arthritis in the rear legs. Perfect to lower weight, but they could use suggestions. I also have a huge 10-year-old German Shepherd that is above 149, but his body score fits his size and height via veterinarian. So the veterinarian says that he's in good body condition score. Is there something to help him? I notice more turned areas with his size as he has aged. Very active, but I don't want future issues. That's a couple of good questions there, Sue. So I think we'll start with your parents' small terrier. I think that a cetyl myristoyl product would be a good choice for that. It's been shown to have some good pain control qualities. If you don't get adequate pain control, you might have your parents talk with their veterinarian about some prescription pain options, and that's the next topic that we're going to talk about. But I would try an over-the-counter product first to see if we can't get that pain controlled adequately. Either way, start that cetyl myristoyl because that's going to slow the progression of that disease. For your German Shepherd, the pet's not displaying any symptoms of arthritis, and that's awesome. We can keep that body condition ideal like he or she, I'm sorry. And then you can give some joint supplements to help support the health of those joints. So I would look for something with hyaluronic acid in combination with chondroitin sulfate and glucosamine. Some of our Cosequin products have that combination in there. And so if you can find something with that combination, that's going to really help support those joints moving forward. Okay, so the next question. I have a Great Dane, just turned 7 and is ideal weight, still active. What should we be doing to help prevent arthritis? That's a good question. So active dogs, they are prone to it, especially big dogs. To prevent it, we're going to want to talk about the same things. We're going to want to keep that weight ideal. So as they age, they're prone to weight gain. So we want to keep an eye on that. We want to make sure that as we age, the activity level stays high, but we want to minimize those activities that can cause some joint damage. So like fetch might be something that we have to do less often, and maybe change to more controlled walks on a leash, romping in the dog park with other dogs. We want to minimize those things. We don't want to, if they love doing these things, we don't want to take them away completely. But those types of activities are going to exacerbate that joint damage and maybe set us up to really become arthritic later on. Okay, so 10-month-old puppy with severe hip dysplasia. What supplement do you recommend? That's a tough one, Nikki. That's a good question. So that's, unfortunately, that puppy is going to be set up for some problems. What hip dysplasia is, I'll kind of see if I can demonstrate here with my hands, but the hip joint has a socket here and then the ball, and then that is supposed to move within that. Hip dysplasia is when there's a lot of mobility this way. There's not supposed to be. So that hip kind of pops out and it's constantly hitting like that. And so that's really hard on the joint cartilage. It could cause breakdown of that joint cartilage and cause a lot of bone on bone rubbing and pain. So really something to support that joint cartilage is going to be your best bet. And so for that, we're really looking for that chondroitin sulfate and glucosamine. Hyaluronic acid would be a good one too, because if we can have as much synovial fluid in that joint space as possible, that's going to help provide lubrication. Okay, a 13-year-old Beagle Basset, and he is on Rimadyl and gabapentin and a canine joint supplement Endure for his back pain. Is there anything else that we should have him on? Well, that's a wide variety of things to have him on. I guess, Loretta, are you asking because maybe he's painful still? Seems painful. Because Rimadyl gabapentin combination is a potent pain controller combination. And then the joint supplement's going to help try to slow the progression. So, unfortunately, there's other options that you could put him on for prescription pain medications. That might be a discussion to have with your veterinarian. But during this discussion, I don't really have anything that I can offer for you. So that might be a discussion to have with your veterinarian to see if there's other prescription pain medications that he or she would be willing to put your dog on. Okay, so a couple questions there popping up. Loretta says, I was told you had to be careful with joint supplements and Rimadyl. Okay, that's a good point. Joint supplements as a whole are very safe. So I'm not sure where you heard that, but really any of the joint supplements that we carry are going to be safe for the animal. We're not going to really see any side effects from them, besides if they have sensitivities, to the ingredients. So if they have food allergies or something like that, we could see some side effects. Rimadyl, as a prescription pain medication, it's a non-steroidal anti-inflammatory. We can see some side effects from it, specifically liver, kidney, and GI side effects can be something that we have to watch for. So being as it is a prescription, your veterinarian needs to be involved and they need to have that discussion with you about what you can do moving forward to minimize those risks and how you can monitor for them. So Okay, so Sue says, I also have a boxer. Never have had any joint or arthritis issues with any boxer. My present one is 4.5 years old and last year had a partial tear ACL. He healed without surgery, but should I have concerns with any arthritis in the future? Good question, Sue. So yes, whenever we have a ligament tear like that in the joint, we get more motion in that joint than normal, and especially because it's not stabilized surgically, we're always going to have that problem. Now, there's going to be some scar tissue that's going to try to help stabilize that joint, but the biomechanics are going to be off. So that dog will be prone for arthritis development in that leg, that joint. So putting him or her on some joint supplements would be a good idea. Okay. Let's see. So Lori has a question. My Shepherd Husky is 9. He's 112 pounds, great weight. Just been diagnosed with arthritis in his toe. He's always been on a joint supplement and have just put him on Smart Carmelina oil. It has all the omegas. Is this good? He's also on Dasaquin. I'm not familiar with the Carmelina oil, so I don't know for sure. I'd have to look up the ingredient list. Like we mentioned earlier, the omega-3s are important when we're talking about joint health, and specifically with those omega-3s, we want to look for that EPA. So look at that label, look for omega-3s, and see if that label distinguishes between the EPA and the DHA omega-3s. Omega-6s are not really anti-inflammatory for joint health, so we really want to focus on those omega-3s. Okay, a friend of mine said I should get fish oil for my 3-month-old 25-pound Doberman puppy. Excuse me. What dosage and types do you recommend? My favorite fish oil is a salmon oil. We've got it in a bottle with a pump, and so you can base it off of the weight of the dog, how many pumps you give, and they tend to really like the taste. And the salmon oil has high omega-3 EPA levels, so that would be a good fish oil supplement that I would recommend. Okay, Melanie says, I have a golden labradoodle. She is 9 years old. I've been giving her hip action chews since she was a puppy because I noticed she sits lazy and sideways. Recently, a few months ago, my vet put her on Glycoflex chews. After she finished the bag of chews, I found that Belly Vet sells chewable tablets of a stronger Glycoflex, but she doesn't like to eat them. Should I switch her to something else? You sure can, Melanie. If she doesn't like them, that makes it a challenge to get the supplement into them. And so it's better to get something into them than have to fight them. So I think that Cosequin or a Dasaquin product would be a good choice. And we have chewable tablets that are supposed to taste good. And we also have some products that are, more of a small tablet form that if you need to hide it in something, you can do that. We have some liquids if you need to put those liquids on dry food or mixed in some canned food. So we have lots of different options to really help promote the consumption of these joint supplements. Okay, would you recommend Cosequin or Cetyl M for a 12-year-old lab with some arthritis? Body weight 75 with intermediate exercise program, 1 mile walk several times a week. He has been on Cosequin for several years now. So that's a good question, Marcia. Cosequin is just an excellent product. It's great for joint health. The Cetyl M is going to help support that joint, and it's going to provide maybe some more pain control than the Cosequin. So I wouldn't really say one or the other. Ideally, if it's within your budget, you could even give them both, and there would be nothing wrong with that. They're not going to cause any contraindications or anything if they're given together. So use one or the other, or you can use them both. If you've used the Cosequin and you like it, stick with it. If you want to add the Cetyl M in there, I think that would be an excellent choice. Okay, Kinsey says that Libby was diagnosed with severe hip dysplasia and has a TPLO 2 years ago. Okay, we do a lot of conditioning and rehab, and she's doing well. She is currently on Wilactin and a new Dasquin product, working really hard to maintain ideal body weight, and she's going to be 7 in June as a Labrador Retriever. All right. So I'm gonna go ahead and jump into the next topic, and we're gonna talk about some prescription pain medications. So this is kind of a last resort. This is when your pet comes to the point that joint supplements and products and exercise management, weight management, those types of things that we can do at home on our own, often with the guidance of a veterinarian, but things that don't require prescription, things that don't have the potential to cause side effects. When those things aren't being effective anymore for controlling that pain, and we start to be concerned that that pain is affecting the quality of life of our pets, prescription products are an excellent choice at that point. So the most common prescription medications that we put our dogs on are non-steroidal anti-inflammatories, are called NSAIDs for short. And while they do have the potential to cause some side effects, and we touched on it, it would be the gastrointestinal tract side effects such as ulceration in the stomach, kidney or liver side effects that can kind of affect the function of these organs. But these side effects really are pretty rare, and if they do happen, they can be manageable for the most part. Uncommonly, rarely, we do have some very severe, especially hepatotoxicity or toxicity of the liver. Talk with your veterinarian. I'm comfortable prescribing these medications for most or all pets that I see, and so it just needs to be a conversation. It needs to be monitored for with your veterinarian. Blood work and certain symptoms and signs to watch out for when you're giving these medications are important. That being said, they can provide some pain control for our animals and really improve their quality of life and their mobility. And so it's something that's worth a conversation with your veterinarian about getting your pet on. A common one, we've got lots of different ones available, but a common one is Galliprant. And I do have a box out here because I wanted to mention it. It's kind of a red box. It's spelled Galliprant. And this is a good one. It's kind of a novel non-steroidal anti-inflammatory because it has a very good safety protocol. And the reason for that is because a lot of our non-steroidal anti-inflammatories attack the pain cascade kind of high up where those pain receptors are started. And those things that it decreases the production of are used for normal bodily functions. Now, this Galliprant attacks that pain cascade farther down, closer to where it actually causes the pain. And so we tend to get less side effects from using that product. So it's an excellent product. There are many other non-steroidals that are safe and very effective. So, have that discussion with your veterinarian, see which medicine he or she recommends, and then talk to them about the risk of side effects and what you need to do to monitor for those. Now, arthritis is a progressive disease, and we can try to slow the progression of it, and we can effectively slow the progression of it, but it will always progress. And so it'll get to a point where it seems like your medications are not working well anymore. Typically, the answer is not to increase the dose because that really increases the chance of some side effects. But then you can start to talk about adding other medications on. And we did have a question about that earlier. Gabapentin is a common one. Tramadol is a common one. And I mean, honestly, there's so many other things that you can add on. CBD oil is becoming more and more common. So all of these need to be things that you need to discuss with your veterinarian before doing because they are prescription, and your veterinarian needs to be involved with it. But they can be excellent tools in our fight against arthritis. So that being said, if we've got some more questions, I'll go ahead and address them here before we finish up. And if you guys think of anything, please put it in the box, and I'd be happy to talk about it with you. Okay, Lydia asks, is chondroitin, she has a couple of questions there, so I'll address them both here. Is it chondroitin a good ingredient to look for along with the glucosamine omega-3? Notice if he steps in just the right manner, getting up from laying position, he winces. Was told he was worn cartilage on both paws around what I would compare our wrist area. And then also is collagen, something to look for in a joint supplement. So yes, chondroitin is a good ingredient to go along with glucosamine. Glucosamine and chondroitin can be synergistic in their effect on that joint cartilage. So yes, I would tend to use something with both of them. Collagen, I don't think there's been much investigation on collagen for joint health. So I'm not aware of that being beneficial. Now, you do bring up a good point, Lydia, is that one of our first signs of arthritis typically is soreness or stiffness after standing up from lying down or resting. Another common symptom is trouble going upstairs. They have trouble with that in their hips. So a couple of good points there that you brought up. Okay, Melanie says, my vet does not want my dog on both gabapentin and Rimadyl. So we do gabapentin twice a day and Glycoflex Chews from Valley Vet. Okay. Okay, Kinsey, I had Libby on HLA, but my vet didn't have any evidence-based data. Is there any available? I'm not aware of any evidence-based data available on that. I don't have any research projects in my back pocket that address that. So I'm not sure on that, Kinsey. Okay. Loretta asks, can we purchase the pump fish oil from Valley Vet? Yes, we do carry that. It's a salmon oil. I can tell you what I'll do is after our live visit here, I'll get on and I'll respond to your comment there, and I'll provide an item number and a link if you're interested in purchasing that from us. Okay, is Veterinary Liniment Gel Lotion safe to rub on my rescue 9-year-old Beagle mix for when he has joint discomfort? Yes, and that's one that I guess I didn't discuss, but that is another option, is some topical liniment gels, and it is very commonly used in people, and we have lots of liniment gels available for pets, and it provides that hot or cold sensation, and that can provide some joint relief. So yes, it is safe. Okay, so what is the difference between Cosequin and glucosamine? Okay, good question, Lydia. So Cosequin is a brand name. So they're a manufacturer, and they manufacture these joint supplements. Glucosamine is an ingredient. And so many of our Cosequin products have glucosamine included in them. Okay. Next question is, Bob eats tuna daily, but I worry about arthritis in the previously broken toes. Can I give him the salmon oil also? He's only 2, but still limps years later. Yes, you can probably give him the salmon oil. We maybe start to get to a point where it is an oil, it is a fat, so we have to think about calorie consumption. So maybe have that discussion with your veterinarian and see if, what kind of caloric intake you want to have your dog on, because we do want to make sure we get enough dog food and other nutrients into the pet as well. Okay, Melanie, is this being recorded on Facebook so we can watch it again and see all the comments? Yes, you can see all the comments. You can rewatch it. And I think all of these comments, if I'm not mistaken, are going to show up underneath of the video. So you can scroll through them. And so you can look at the comments and all the replies that we have later. Safe for diabetic dogs. Good question. So I guess it depends on the product. You would want to look at the sugar content within the products. Most of our joint supplements are going to be low sugar. So I would say most are going to be safe. That's something that before you purchase it, specific product, talk with your veterinarian or call and talk to me about the specific product. We can look at sugar content and we can see if that would be a good option for a diabetic dog. Opinion on Lubricin as a supplement. Good question. Lubricin is a great choice. and it comes in a liquid form. And so for a lot of pets, that's the most convenient way to get the medication into them. And I believe from memory, I believe it's a hyaluronic acid based joint supplement. But don't quote me on that 100%. But I'm fairly certain it's a liquid based hyaluronic acid supplement, and it is an effective one. Which is the most gentle on the stomach? 11-year-old lab. Good question. The Dasaquin products are going to probably be one of the more gentle on the stomach. Just because they're not very rich. Some of the oils can be kind of rich and cause some stomach upset. So Cosequin, Dasaquin, more pill formulated products are going to be gentler on the stomach. The best anti-inflammatory products. So the acetyl myristoyate is probably going to be our best one. That's going to be over the counter, more of a joint supplement. But the very best anti-inflammatories are going to be our prescription medications, our NSAIDs. They're going to provide the most potent anti-inflammatory action. So, well, if there's no more questions, I'll turn it back over to our hosts here, and stay tuned because they have an exciting announcement for everybody. Thank you, guys.
All right, guys.
This is important.
It is important. All right, we're going to go ahead and draw the winner. If you guys have any more questions, go ahead and put them in the comments, and we will have Dr. Tony answer them for you. So we are giving away a gift card today. So the winner of the gift card is Loretta Tozer.
Yay! Congratulations.
Congratulations.
All right, we have a special giveaway to announce. This is the Positively Awesome gift card giveaway. For a short time only, claim your chance to be one of 5 winners to take home a $100 Elanco Pet and Valley Vet Supply gift card. So the deadline is May 27th, and we will announce the winner on June 2nd. So make sure that you get entered in that as soon as you can. Also,
we still have our Spraymaster Spectacular giveaway going on. The deadline on that is June 24th, so get signed up now so you don't forget.
all right, that's it for today. Thanks, Dr. Tony. We appreciate it. Join us again next week.
See you guys later. Bye.